Hey everybody, this is Marla, and I'm back to give my informative speech. My speech will be given on ITP, idiopathic thrombocytopenic purpura. ITP is a blood disorder in which the body destroys platelets. It occurs when immune system cells form antibodies that destroy the platelets in the blood. Platelets clump up to clog holes in damaged blood vessels. Symptoms of ITP include frequent and easy bruising, small red dots under the skin called petechiae, and also nosebleeds and blood blisters in the mouth. In children, ITP is caused mostly by viral infections. In adults, ITP is generally chronic or long-lasting and can be caused from viral infections, pregnancy, some type of drug, or any other immune system disorder. Treatments. Treatments of ITP can vary. There are many treatments out there, but most of the common treatments are prednisone and splenectomy. Most adults are generally put on an anti-inflammatory steroid called prednisone. Prednisone is a good treatment, but it has very many negative side effects. Side effects of prednisone include weight gain, frequent sweating and hot flashes, swelling, acne, increased hair growth, and excessive mood swings. Splenectomy is a good option also, but it only helps about 1/2 of the patients. It is possible to live without a spleen, but however, your spleen controls your immune system and makes antibodies. So without your spleen, you're at higher risk for many diseases or sicknesses. Although ITP is not a disease that you can see on the outside and is internal, it's still very dangerous. When I was 15, I was diagnosed with ITP. I've had it for almost 5 years. When I was 15, I didn't think that it was very dangerous at all. I remember going into the hospital at Wolfson's Children's Hospital in Jacksonville. I couldn't wrap my mind around why this disease was so dangerous and why they were so worried about me. But when I got to the hospital, my platelets were under 1,000. Normal levels are between 150 to 450,000. Anything under 10,000, you're at risk for brain bleeds and internal bleeding. Even after I talked to my doctors, I didn't think it was a really big deal. I insisted on walking in the hospital, and I wouldn't let anybody put me in a wheelchair because I felt fine. And even though, looking back, I know I didn't think it was a big deal, but I'm so very blessed to have been through everything and been okay, even though I didn't know it was dangerous. Because now that I'm older and wiser, I can tell that it really was a big deal. In conclusion, ITP is a very common disease actually. There are 22 million people diagnosed with it per year, but almost everybody around doesn't really know what it is. And ITP is not curable if it's considered chronic. It's treatable in most conditions. And although it's an internal disease and you can't see it outside, it's just as dangerous or maybe even more dangerous than some of the physical diseases that people suffer from today. Maybe that's it.